Let's take another video question, doctor. This one is from Valerie. Let's listen.
My first question is, what is the most common type of skin cancer? And what is the race most affected by this common type of skin cancer?
Great questions from Valerie.
So skin cancer there's different types, but the three major types is what are called basal cell carcinoma. That's the most common type of skin cancer. And most of the time, basal cell carcinoma is really more of a nuisance than anything else. It's kind of a festering sore that doesn't want to heal. But if it's not properly taken care of, it can grow to be destructive, so destructive that it can, for example, on a place like the face, it can destroy a nose, an eye, an ear. And so it is important to treat it. And if it's treated early, that can be avoided. It's very uncommon for basal cell carcinoma to spread internally, but it can happen as well if it's ignored enough, or if the person has medical problems that make them more susceptible to it spreading internally. The second most common type of skin cancer is squamous or squamous cell carcinoma. That one is a little bit more serious than basal cell. Most of them behave like basal cells, and again, they're just more of a nuisance, and it's just important to make sure we get rid of it. But some of them, in certain areas, for example, like on the lips, on the nose, on the eyelids, on the ear, on a previous scar tissue, in those areas, they can be more aggressive and they can spread internally and can actually kill somebody. And then there's the other less common but a very deadly type of skin cancer called malignant melanoma, which is usually a dark spot on the skin. And the malignant melanoma is the type that can spread internally and kill people and is deadly. So that's the one that many people think about in terms of moles and changes in moles or dark spots that appear. Those are the ones that we want to make sure that we know exactly what that is, because that's a very serious tumor that can kill people. Now, the other question that was asked is, what race or who commonly gets skin cancers? Well, the bottom line is everybody can get a skin cancer no matter what the race. But there's no question that the less the more fair your skin is, the more at risk you are. So people that are very fair tend to have a very higher incidence of skin cancer, including basal cells, squamous cells, and melanoma. People who have darker skin still can get skin cancer, but they don't tend to get it as often as people who have light skin. But that doesn't mean they can't. And so, for example, if you have somebody who has black skin, they can still get skin cancer, not very common, but you can sometimes see it in some individuals that are darker and they still get that. The other problem is that these individuals can get skin cancers in areas like underneath their nails or their palms or the soles of their feet. And so again, if you think there's a pattern there, right? In the areas where they don't have as much color, they don't have as much protection. So color protects the skin in that sense. Having said that, it's not a good idea to go out there and get a tan, because the reason your body tans is to try to protect you, but it's because you've injured the skin and therefore you get color. So getting a tan doesn't really give you that protection that you want, because it takes an injury to cause that tan, which is what you're trying to avoid. So I hope that answered the question. So as far as race is concerned, the white individuals tend to get it more often. And then as you have more pigment in the skin, you get that. But, for some groups, for example, like Latinos, come in all sizes, shapes, and colors. And so therefore, they're at high risk for skin cancer. And one of the problems that happens there is that people think that because they have Latin skin, there may not be as much at risk. And in fact, because of that, a lot of these skin cancers are diagnosed later in these individuals because nobody's looking for it, especially things like a melanoma.
All right, let's move on to another video question, and this time it's from Isabel. Let's take a look.
Hello, my name is Isabel, and I have a question regarding a mole that I have on my back. I've had it my whole life, but I recently discovered that it started to change color, and it's been giving me a weird pulsing sensation. Here's a picture of it. And I just want to know if that is something that I should get looked at by a dermatologist, or if it appears to be something malignant. Thank you.
So the answer is yes.
She had a picture and everything.
Yeah, no, that was very good. The answer is yes. Anytime a mole or any spot on the skin changes, that's a good time to get it looked at. And that's a good time to see a dermatologist evaluate it. As a general rule, just so that you keep this in mind, we do what are called the ABCDs. A stands for asymmetry, B stands for border, C stands for color, and D stands for diameter. And then we actually go a step further, which is A, B, C, D, E, and E stands for evolution or evolving. And so, for example, E trumps everything else, which means that if something is changing, then we worry that it could be something significant. The good news is most things that change turn out to not be anything serious, but we can't take that chance, especially with moles, because moles are the ones that can be confused with a melanoma, and some melanomas do start in moles. So it is important that if there's a mole that changes, especially in that mole, that should be looked at and checked. If it's not a mole, but let's say it's a red spot or some other bump on the skin and it's changing, good idea to get it checked also, because skin cancers, that's one of the signs and symptoms of a skin cancer. It's a new change, a new symptom. But now let's get back to the ABCD. If you're looking at your moles and they're not really changing and you want to decide if they're serious or not. So by and large, we use the ABCDs. And if you have 2 or more of those ABCDs, we consider that a reason that you should go get it checked. So for example, when you look at a mole, if you were to kind of divide it down the middle, if one half looks different than the other half, that means it's asymmetrical. That would not be a good sign. B for border means that if we look at the edge and you really can't tell where it begins and ends, it's kind of a fuzzy kind of a border, then that's not a good sign either. We want things to be symmetrical. We want things to be nice and sharp. C stands for color. If the color is irregular and it's not even, then that's another reason to get it looked at. We like to have a nice even color. Sometimes you can have a really, really dark color and that doesn't mean it's bad. But if you have a really, really dark color, sometimes that's a reason to get it checked and say that that color is something suspicious, especially if it's a recent change. And then lastly is D for diameter. And this is probably the weakest of all of those in the sense that we kind of look at it from the size of a pencil head eraser. So if you have a pencil, the head of the pencil has an eraser on it, that little red eraser. If something's bigger than the size of that eraser, which is about 6 millimeters or so, then that can make us suspicious for things. The reality is the reason we use that size is because things that are smaller, it's hard to tell what's going on in terms of asymmetry, color, or borders. So size is really not the major factor, but it is a factor. If you have a larger lesion and it has that it's large plus other changes, then that would give you a reason to think that it needs to be looked at. Now, the other reason that size is important is because sometimes we're born with certain moles. Like that young lady talked about having had a mole that she was born with. Well, those are congenital nevi, and congenital nevi that you're born with can go on to become melanoma. The good news is most of them never do. It's the larger ones that can sometimes develop melanoma. So a larger mole that you're born with is something that's a good reason to get checked, just to make sure that it's not the type of congenital mole that could be at risk for some kind of change for skin cancer.